everyone. My name is Ming-De Chen. I'm the last presenter of this conference. So it's very honored to be here and especially arranged as the last presenter. Because in baseball game, that the last pitcher on the mound is very important for the game. So I will do my best job and finish the game and win the game. All right. I'm from Kaohsiung Medical University and my department is in OT. And today I will show you just finished a new research project and show you some interesting outcome about a new dual task training program. And our purpose is want to improve the balance for people with schizophrenia. Just in case those didn't know KMU well, so we next year will be the KMU the 70th anniversary, and we are located in Kaohsiung, which is one of the major cities in Taiwan, and located in the southern part. So weather is good and the food is good, and it's very beautiful. And the scale of our school, so you can see on the screen. And for our college, the College of Health Science is pretty similar to the FHS at the Hokkaido University. You have an OT, PT, and we do have a medical technology, medical radiology, and health administration, and public health. And we do have the one AI master program. So I want to thank for the National Council, National Science and Technology Council for supporting my research, and I also appreciate that two of those participants joined this study, and there is no conflict of interest. And why this is important issue? Because the schizophrenia is one of the major leading disability now. They have, if you know something about schizophrenia, it's not only about their mental health, it's also about their physical health. So they do have required a high medical cost. I think it's the one of the 10 toughest medical cost when we're treating this patient. And also the other problem is that they have a longer hospitalization. After their symptom onset, they will go to the acute ward and they go to the chronic and they go to the community rehabilitation center. So it takes quite long. And for people with schizophrenia, they also experience some mature aging and athletic aging, which means they age at younger time and also they die faster. Like according to the national health insurance data in Taiwan, that the people with schizophrenia, they compared to the general population, they die like 9 to 16 years shorter. So it doesn't make sense that we make some health prevention for the elderly. Like general population, we start at 65. For them, it's too late because 65, most of them is going to die. So we need to have some health promotion before they experience some aging symptom. So in terms of the premature aging, like balance issue, they experience some fall risk and injuries fall risk. Injury falls like they falls in the central hospital. And they even starting at the later 30s. So I think most of them, if we are 30s, we are very active and we want to do a lot of things, but their balance function is still decline. So in psychiatry rehabilitation, that we are thinking about how to improve their balance and also implemented for prevention. Now it's a key. The key issue, especially when you go into the hospital to see those patients with the schizophrenia diagnosis, you can tell even they are young, but they look old. Yeah. So I just remind you that their premature aging is a very one important issue. So in terms of the balance training program, now the traditional we have some balance training either in the nursing, in the PTOT, the training. But now they have a novel balance training program that combine the cognitive and the balance training together. We call the dual task training, and they do find some interesting finding in other population, including Parkinson's disease, stroke survivor, and the mild cognitive impairment. So because there is no dual task training for improving the people's schizophrenia, so that's why I want to doing this study. So I have two phases for this study. The first one, we were trying to develop a new program. We combine the cognitive and balance training simultaneous software. So in the past, in the literature, usually the trainer will do some physical training with the participant and say something like, when you are walking and you sing a song, or when you are walking, you have some calculating task. But I consider that this is very manpower challenge. So because all the cognitive task is produced by the trainer. And for a trainer, I need to protect their balance and also need to give them the task. So I'm thinking maybe it's good to have a software, so we call it a Cobbell software, and we have a pilot, and then we use that randomized control trial to test its effectiveness on the balance, cognitive, and the muscle endurance. So the participant basically is you need to have diagnosis with schizophrenia mostly or schizophrenia affective, and the age is around 40 to 75, and their mental symptoms should be stable and be able to walk like 10 meters, and no obvious cognitive dysfunction. And because if they have a cognitive function, it's not gonna possible to make them to do dual task at the same time. And for exclusion, we don't recruit people living in the acute ward, and if they have alcohol or drug abuse currently is excluded, and they need to have ability to carry out this intervention safely. So the first one, the result, this is the settings I want to show you. On the middle screen, you can see we have the all-in-one computer, and that is because we need that is more compact size that can put on the task. And on the screen, you can see that there's some balance training video or showing some cognitive task, so that the people the participant can learn what kind of task they are doing. And the setting, they have the AI or computer, and also connected with a scanner. That scanner that allow us, we can to record a response by using the cognitive card. On the left side, we specially develop a Cobbell cognitive card, and I bring here. If you're interested, you can just take a look. If they have 100 cards and divided and either in the number or in the shape or in a different category. And on the back of the card, they have the barcode, just like you go to a supermarket, and that barcode, they can take the response from the participant. And we do have a space that allow the participant, they can do something balance training. So at the same time, they finish this the dual task training. Right. There's some example, like when in the middle part, you see we do have the balance training. There are three types. One is called the static balance. The other is strengthening training. The other one, the final one, dynamic. So those three types is very common when you see it in the balance training. And the other one is we develop 4 types of cognitive training. We having attention, memory, process speed, and cognitive flexibility. Like, as an example, we have a participant stand on the foam with their feet together. At the same time, we give them attention task. Like please clap your hands when you hear black tea. So either black tea, the green tea, or the milk tea. Yeah, so they're separately. So they need to focus on their balance and also need to answer the attention question. The other one is strength training, plus with the process speed. That when you're doing the scissor strong, paper scissors strong, and the screen will show either the boys win the game or the girls win the game. The participant need to count at the same time doing the strength training. The other one is the shape, S-shape walking around thing. So when they're walking in the hall, they need to pick up car that are triangle in shape and have odd numbers. Yeah, so at the same time, it's a dual task. So I just give you that the short video.
第一步，暖身操。做暖身操，暖起身子，开启今天的训练。第二步，开始训练。训练方式一：静态平衡加认知任务。训练方式二：肌力训练加认知任务。答题时使用 A、B、C、D 选项骰子，对准扫描器，扫描上方的条码即可答题。训练方式三：动态平衡加认知任务。答题时使用 Converse 卡牌对准扫描器，扫描卡牌背面的条码即可答题。卡牌的正面有各种不同的图案和形状，让认知题目变得更加多元有趣。第三步，收操。训练结束后做收操，以避免受伤。
So this is a short video of our dual tasking training, and and then I will present our randomized control trial result. So we recruited 84 participants with schizophrenia and randomized located in the three groups. The two groups is cowbells, dual tasking, and all the other one is balance training only. And we also compare with the treatment as a usual group, we call the TAU. So two training groups, they're training for 6 minutes in a group format, and twice a week for 12 weeks. And so the assessment we have a primary outcome, we focus on the balance function, and we also have some secondary outcome. And analysis was analyzed with the generalized estimation equation because we have some dropout. So this is a quick demographic of our data. The male have a little bit more number, and the mean age is around 50, at the range 40 to 70, and the length of illness is quite long because, as I told you, that they onset at a very early adult. So when we are doing this study around they're 50. And they are stable according to the clinical global impression severity, and mostly living in a community, and we don't find a significant difference among the groups. And this is the result. We use the mini-best. It's a balanced evaluation system. It's a battery, so it basically it's a 14 balance task, and it can divide into the 4 domains. And on the right, this one is the mini-best total. Yeah, you can see in the red one, the red line is the dual tasking, and the blue line is the balance training only. So you can see the clear trend that's showing both training have a positive outcome compared to the TAU. And most interestingly, you can also see the dynamic gait it's only showing a significant difference in the dual task. Yes. And then the next slide is about their balance training on the single and the dual task. So the one leg standing and even the time up and go, you also see the clear face that both training groups have a significant impact compared the TAU. But when they're doing the motor task and the cognitive task, like the dual task, they do have a better job than the balance and than the TAU. So we consider that is the training related effect. And in terms of their gait parameter, because the people with schizophrenia usually they walk slowly, and that is because their step length is shorter. And our results show that the dual task they can improve their walking speed and also improve their step length, which is good for them. And this is a muscle endurance. We do find quite a similar the trend for both training group, but for the dual task they have a better outcome. And the cognitive flexibility. And we do not find any significant change in terms of simple coding, this span, like the process speed and memory. But we do find in the both group they have a cognitive flexibility, quite a similar the trend. So the discussion that compared the trend as usual, the both training group, they can improve on the balance battery or the static and the dynamic balance, and particularly for the balance, for the Cockbell, the dual task group, they have the better outcome on the dual tasking when they are doing the some balance challenge, and also on the guidance parameter. Yes, and the other one is that even for the balance only training program, we also find some cognitive benefit, and that I think that's very important. That usually, when you look at the literature, the balance training they don't measure a lot of cognitive. So think about it when you want to maintain your balance. It's not only about your physical health, physical ability, also need to your brain to work on it. But the other one is the process speed and the memory. We don't find a significant finding because maybe like the training dose is not enough. So I'm thinking if we want to combine the two things together, our brain is very busy. So if we want to doing like a balance training at first and also combine the cognitive, that cognitive challenge should be not too easy and should be not too difficult. If not too easy, it's not called have the dual task divide the attention. But if it's too difficult, that the participant they will stop and think and work. They're gonna miss the joy of the dual task training. So the other issue is we need to have more study on what is the most suitable cognitive task while we can match two things together. Some meditation that our participant is around 50 and also living in the community and the no follow-up assessment. And conclusion, so it's a new training program and we do find some interesting finding and we encourage the more study looking at after 50 age and inpatient, and we are looking at some role and function of cognitive function in the dual task training. So I really appreciate that this time. This is my first time to Sapporo, and tomorrow I will go to Sapporo Dome to watch the high baseball game. And this is the picture is the Kaohsiung city. It's a harbor city, and this is very beautiful city. So I'm glad that I'm here to join this wonderful conferences. Thank you so much. Thank you.